you for. So this to me is not living wage, this is rhetoric. Yeah. $15 an hour minimum, higher based on the actual cost of living, 75 cents a year to get there. Thank you.
So I voted for the minimum wage increases in New Mexico in this legislation. This governor has blocked them, and we've tried to get around here by making it a constitutional amendment. And we do it as a constitutional amendment. The public decides, not the governor. The governor can't veto a constitutional amendment. The fact of the matter is that for those of us in Las Cruces, we've led the state in southern New Mexico. And that's an interesting thing, because I know when I come up to other parts of the state, the thinking is southern New Mexico is more conservative. Well, I got to tell you, our city council, our mayor are all progressives. I'm glad to have the mayor's endorsement in this race in southern New Mexico. And southern New Mexico has led. And we did it the right way. We studied the wages. We brought together the business community, and we had buy-in. And I've got to tell you, you've got to have the buy-in when you establish these wages, because if you don't, what ends up happening is what's happening in our country with Obamacare or the other great things that were accomplished during the Obama administration, which is the next administration comes in and tries to sweep them all right back out. When we have the buy-in from the business community, when we have a community that comes together and realizes what that community truly needs and what the people need and deserve as a living wage, we have that cooperation. I got to tell you, we have that in Las Cruces. The businesses support it, and the employers, like me, all support that wage in Las Cruces.
Thank you.
Do you support single-payer health care? We do support single-payer health care. I'm a private business guy. Guess how much money I pay a year for my 2 children, my wife and I? Before any health benefits, $22,000 a year. And unfortunately, I'm not in Congress where I'm going to have health care coverage for the rest of my life. It's time we start. Well, look, folks, what we have today doesn't work. So we're for single payer, but we also have to pay a fair wage for doctors. We have to streamline it, but we also have to bring more doctors in, and we have to start investing into more urgent care areas. The biggest problem we have, too, is the high-risk pool. And then a lot of our people go to the emergency rooms. We need to start it. We have one of the best medical institutions in the country right there in Albuquerque, University of New Mexico. So we're going to invest with them to expand and create 300 more doctors in our state. That's what we're short. Every doctor we put in your community, $1.8 million of economic growth. Every doctor we put in your community, 3 to 6 new jobs. So it's about investing and expanding what's working today. It doesn't work today. So that's what we have to do.
So let's start with a value. I believe that healthcare is a right, not a privilege. Right? I do. I always have. I've worked hard to address the challenges in the Affordable Care Act in Congress. And this is a Congress, right? A Republican Congress has done everything they can to destroy the Affordable Care Act, including failing to provide the investments that would lower insurance costs and out-of-pocket costs for consumers. I want to challenge one of my opponents that members of Congress do not get health care for life. They can retire after 30 years and get a health care benefit. But like all other Americans, I have to buy, and I should, my health care on the exchange. Only unlike New Mexicans, I can't buy it in New Mexico, so I can't get it from a nonprofit healthcare company like Healthcare Connections. I have to buy it in DC, so it's more expensive. Here's what we are going to have to do. We ought to do Medicaid buy-in. I got a bill in Congress. Let's do that here. Let's make sure that we also do Medicare buy-ins, and then let's have regional, state-by-state collaboratives for healthcare redesign that will make a difference for every New Mexican and will draw the healthcare infrastructure and practitioners we need.
I have endorsed the New Mexico Health Security Campaign, which has been around since 1993 and supported by 145 organizations in our state to provide single-payer health care for everybody who is not currently on Medicaid, Veterans Administration, or Indian Health Services. I'm the only one endorsing that. I need to make a point of difference with the Congresswoman. House Bill 676, Medicare for All. 120 Democratic co-sponsors, but none of them are from New Mexico. So buyer beware when we hear about we're going to help healthcare, we're not seeing the action supporting the bill that gives us single-payer healthcare for all. So please, also check opensecrets.org. During the during the Congresswoman's career, $110,000 in donations from insurance companies. I'm not saying that there's anything corrupt going on. I am saying that this bothers me. Thank you so much.
Senator?
So after a year out of law school, I joined the state's largest law firm, and then after about a year or two, I got tired of that and wanted to start my own law firm, a small businessman. The first check I wrote was to pay for the health insurance of the secretary who left that big law firm and took a chance with me. And in the 25 years since then, I've always paid for my employees' health insurance and will continue to do so. I know the cost to business, and I know what it costs all of us to do so. But I've got to tell you that the Health Security Act, Peter, one thing that you learn in the legislature is you learn how to read a bill and you learn how to read the fine print. And the problem with that bill, frankly, is that it put the governor in charge of appointing a 7-member commission to be in charge of our health care in the state. That's what the bill did. Now, do you want Susana Martinez to be appointing the commission to be in charge of our health care? And if you do, go look and see what she did to mental health care and behavioral health care in our state. We have to come up with a plan that clearly recognizes, as the Congressman said, that healthcare is a right. But Congressman, as I understand it, you're in the health insurance business, or you have been in the past. And the bottom line is that there is an economy, and there are those who make profit off of the healthcare needs of others, and we need to stop that profit motive.
So, as governor, will you continue or end the practice of continued privatization of the behavioral health care system and seeing the consequences that we've had? We need to bring back behavioral health. Behavioral health, what this governor did to behavioral health is sinful. Again, we talked about what we do. We put 15 New Mexico businesses out of business. And now 6%, almost 6% of the people that are in our prisons have behavioral health. Our law enforcement has to now deal with it. So we have a plan that we would actually fund behavioral health. And then behavioral health gave me this idea. I didn't come up with it. We would then create a Medicaid tax with the behavioral health industry that we then can go get Medicaid funding and triple those funds back to New Mexico. It's Medicaid dollars we're not capturing today. So as your governor, I will actually give funding to those 15 companies, bring them back, solve the behavioral health, and go after more Medicaid dollars to help New Mexico's issues. It's something we have to do. Thank you. Representative.
So I don't know if I quite understand the question about privatization. I think the issue is that we don't have mental health parity in New Mexico because our governor canceled 100% of those behavioral health contractors. Many of them were nonprofit. The majority of behavioral health is nonprofit. Today, the only place we're getting behavioral health is in our correction system. It's deplorable, it's immoral, it's wrong. There's a federal investigation that we've launched, your congressional delegation, which is now taking place by the Health and Human Services Department, which is both a benefit and a problem because we're likely to have a liability as governor, but we also have to know how much money we weren't spending in behavioral health. We're going to have to also create regional behavioral health programs. Look for addictions, we need addictionologists, and here's the thing I know. I don't refer anyone to New Mexico programs with significant addiction. They need a 3-year program where we could be trading with other states. You need to create an evidence-based resiliency program. It should be funded by Medicaid, and it should be leveraged in all of our contracts with our private insurance companies in the state.
Thank you.
So the bottom line here is that Governor Martinez was totally crass. She created false charges against the behavioral health providers in our state, used that as an excuse to fire them, and then just happened to hire big donors from Arizona to come in and provide these services. Meanwhile, there was a gap in services here. Then the Attorney General found out there was no substance to our charges, so those companies left, so we had a second gap in services. So it's nice to say we've got really good plans and we're going to do this and we're going to do that. The bottom line is I'm going to be a governor that doesn't have to pay anybody off. Cabinet secretaries are going to be from within agencies. We're going to put these priorities where they belong. I've been working in public health for 20 years. I get this, and this is why I'm running the campaign I'm running. I'm trying to run a campaign based on values that puts people first. And this is the bottom line I think you need to make your decisions based on. Is it going to be true? Is it going to be true that all these pretty promises you get are going to get delivered? Or are there other things at play?
So the behavioral health care providers that were put out of business by this governor, 7 of them are in the district I represent, southern New Mexico. And Peter described the story right. The governor brought in big donors from Arizona to come and take over the program. The problem is that after a year or two, they weren't making enough money. They decided they're going to leave too. They gave us a couple of months' notice, said we're out of here too. And that left all of the communities hanging. In Doña Ana County, we came together. I'm real proud of our family's contribution to reopen the hospital, Memorial Medical Center. We put $1 million of family money together to try and reopen that hospital to provide behavioral health through La Clínica de Familia. And the fact of the matter is that we've been using our court system over the years to try and provide our mental health care. The police and the corrections and the courts rely upon our prisons and our jails to try and treat these things. And I'm proud of the fact that in the legislature, we passed the AOT legislation, the Assisted Outpatient Treatment, that allows individuals to access the courts without going through the judicial process, without having to go through incarceration, and without having to rely upon our jails to seek that treatment for mental health care. We need to make that available in all of our communities, including opioid abuse and other drug addictions.
So the Taos News just had a wonderful but depressing piece on the opioid crisis in northern New Mexico. And we know it's not just Taos, it's not just Rio Arriba, it's the entire state. What is your plan to address the opioid crisis?
It's an issue. Our state is one of the worst. And in fact, the Albuquerque Journal wrote an article the other day how now we're down to like 12. The overdoses and the deaths, they actually haven't gotten better. Other states have gotten worse. And we have an opponent up here who actually voted for a bill to allow opiates to go freely through pharmaceutical companies. Freely. Our opiate addiction or overdoses skyrocketed in our state because of that. So as your governor, we're going to decriminalize a lot of these issues and move $200 million from our criminalization and into rehab and treatment programs. We're going to move that into middle schools and high school programs. We're going to keep our kids engaged and create opportunities. Again, we have plenty of money. We just spend it and invest it in the wrong way. And we will create 2-year programs with that money to treat them, to get them off. And yes, medical cannabis will help. But we also have to train them for trade skills and job training for the jobs that are open up today.
Thank you.
That we don't
Representative.
Thank you. So, thank you. I think it is, I appreciate that, and I'm probably cutting into my time, that you have been so polite to all the candidates, and I can tell you that we appreciate that you're paying attention and you're clapping for all of us, so I didn't want to interrupt that. Thank you. The opioid crisis, as you know, isn't just an epidemic here. It's now become a national epidemic. It is not going to solve the problem, but I have a bill in Congress that actually would try to get them to reduce opioid prescribing, right, by taxing the number of prescriptions that they make. You got to be careful about good faith dispensing laws because there are people who really need opioids for pain. You don't want to interfere in patients' rights, but we got to deal with the fact that this is a purposeful, forged by the pharmaceutical companies, crisis in everyone's community. They're now selling those drugs to other countries in the very same way they did them here. We're going to have to do 3 things. 1, you have to bring back specific opioid treatment programs into the state. 2, we're going to have to collaborate with other states because opioid addictions are very difficult. The recidivism rates are very high, which means we cannot do the insurance 28-day program. And 3, we're going to have to create investments in early childhood education and family crisis support and family visiting so that you solve these issues that are largely tied to poverty in rural America.
Thank you.
We didn't just get here by accident. The Congresswoman is correct. The pharmaceutical industries are predatory and want us to be addicted. But the Congresswoman is missing that this has been done complicitly with lawmakers. Senate Bill 524 passed last year. All 3 New Mexico representatives voted for it. It kneecapped the FDA's ability to go after the pill mills. Okay? And again, I keep getting attacked for saying how much money comes from pharmaceutical companies, but on opensecrets.org, for the last, during Congresswoman's career, $67,600. So now, What we need to do is what the Attorney General, Hector Valderio,